Mission and margin is the business of healthcare. Thanks to our sponsor MedChat, providing live chat, bots, and text tools for a modern digital front door. See medchatapp.com. We're joined today by Dr. Zeev Neuwirth, Chief Clinical Executive for Care Transformation at Atrium Health in Charlotte, North Carolina. Dr. Neuwirth is also author of the recently published Reframing Healthcare, a Roadmap for Creating Disruptive Change. Dr. Neuwirth, thank you so much for joining us today at Business of Healthcare.
Matt, my pleasure.
One of the interesting things in your book is once you quickly painted the picture of why our healthcare system needs to be reframed, you then postulate that it's reframing the marketing of healthcare is really one of the first most important steps. Talk a little bit about that.
Yeah, healthcare is a people business. It's about people. It's about people who, you and I and everyone else, that have a need, okay? We're not feeling well, either physically, emotionally, relationally, and we need someone to take care of us, to figure out what's wrong and to help us get healthy, okay? Fundamentally, it's about people. I think to a certain extent, because of all the things we've been talking about, the technology and the science and the business of healthcare and the industry itself, I think we've lost our way a little bit. I think we've lost that understanding that it's about people. The field, in my estimation, that can best get us back on track, the field that really understands people, that understands what people need, what people want, how to deliver it to them, to double check on that. The field that has the tools and approaches, techniques, is the field of marketing. So when I talk about the marketing mindset, I'm not talking about marketing healthcare. I'm not talking about selling healthcare or public relations or media relations. I'm actually talking about using the techniques and tools and approaches, the science and essence of marketing, of understanding people to actually transform healthcare delivery. Okay? I've never heard anyone say that before, but I'm saying it because it's true. But as long as we stay in a medical mindset, okay, and don't realize this is fundamentally about people, and as long as we don't take a consumer-oriented marketing mindset approach, we will greatly limit the possibilities and the future of what we can do in healthcare. And by the way, the new entrants in healthcare, they get it. The Amazons and the Googles and the Walmarts and the CVS Healths, they're consumer-oriented. They come from that industry. They know it's about people. They know how to use the marketing mindset. And if we in legacy healthcare don't make that realization, I think we'll become increasingly less relevant.
Give me one or two examples of what are successful models.
I could talk about ChenMed in the same vein. I could talk about Eora Health. I could talk about CareMore, Lumeris, Landmark, Aspire. Many are in what I would call this brand family of complex chronic care. And again, the marketing principle here is segmentation, focusing. I'm not going to try to be everything for everyone, everywhere, all the time, because when you do that, you become nothing for no one, anytime, okay? And so they set up these ambulatory focus factories, and I'm borrowing a term from Regina Herzlinger from the Harvard Business School from 20 years ago, but that's what they are. And because you focus, you hire people who are passionate about this work, you train them, you hire staff, you put processes and policies and protocols in place, you have the right resources, right equipment, you set the metrics up. That's all you're thinking about 24/7, 7 days a week, 365 days a year. How do I take care of the older patient? And they're really blowing the doors off in terms of providing cost-effective, humanistic care with great outcomes. I'm going to move to a hospital system, okay? In fact, I'm going to name two. One is called Intermountain Health, okay? It is one of the best hospital systems in the country and the world in Utah. The other is called Renowned Health, which is in Nevada. They've both done similar things in terms of the marketing mindset, in terms of rebranding, redesigning, and reorganizing healthcare. They realized that there's actually fundamentally two brands that they're serving. And they decided to segment them out and separate them out because they have two different missions, two different sets of metrics. One is sort of the hospital, acute care, medical care system. So Intermountain Health has literally now two brands. They have a hospital brand and they have a community care brand. The hospital brand is if you need a surgeon or you need to be in the hospital or ICU, you're going to get the best care, okay, the best medical care in that system. The community care division, their goal is to keep you out of the hospital, okay? How brilliant is that? Now, Renowned Health has done the same thing. I just absolutely love it. Tony Slanham, their CEO, I had the chance to talk to him the other day. So they figured that, again, they want to deliver amazing clinical care, this transactional care, going to see the doctor, having surgery in the hospital. So they've got hospitals and rehab centers and urgent care centers and surgical suites, and they do an amazing job. That is their hospital brand. They call that their care brand, okay? Then they realized there are other issues in the community, like social determinants of health, helping people age in a healthy way. And so they formed a separate brand, a separate division. They call that their health division. Okay, and because of that, they're no longer mixed up, they're no longer confused, they're no longer working at odds, which I believe, sadly, the vast majority of healthcare systems are. They're trying to mix different brands in. The idea of actually discreetly separating them is a brilliant move. It is a marketing mindset move. It is consumer-oriented. It is patient-centered care on steroids.
You are in the thick of it in your role. But also in the thick of it nationally in trying to influence the healthcare dialogue. Mm-hmm. When you think about digital health, what is the healthcare industry problem that's a response to?
I think digital health is a response to a number of major problems in healthcare today. The first being convenience and access. So it's terribly inconvenient for people to have to leave their homes, their work, their lives, and spend hours, if not half a day or more, just to go to a visit with their physician or other care provider. Digital health holds the promise of making that connection much more convenient, much less time. I would say cost is a second issue. And again, the cost of, just think about this, the cost of this infrastructure, all the buildings, all the equipment that house all the medical care providers, if we could reduce that even by a percentage or two, that would be a huge decrease in cost to care. There's another issue which I think is equally as important, and that actually are clinical outcomes. And one of the major issues right now in healthcare is chronic disease management. And in fact, 70% or more of the encounters in healthcare are actually now just about maintaining one's health, whether you have high blood pressure, diabetes, or high cholesterol, or overweight, or depression. And so the major issue in chronic disease management is that continuity of care. If I have high blood pressure and I get to see the doctor or PA once or twice or 3 times a year, so those are very discrete points, and in between that time I have to manage my own health. But if I'm on some sort of digital platform where I could literally be connected to my healthcare team, to family members 24/7 without any cost, again, there's no cost to it, there's no inconvenience, if I'm able to be monitored digitally and treated digitally. So let's say my blood pressure starts to creep up. Instead of waiting 3, 4, 5, 6 months, a year to go see the doctor, that could be noticed literally tomorrow, and someone can intervene virtually. It actually is not just cost and access, it's actually improving healthcare outcomes.
In that example that you just gave, that idea of staying engaged with that patient more than just for their episodic visits, mm-hmm. How does that cash flow? How does that work financially in a large, complex health system?
That's a great point. So I think this is one of the challenges right now with digital health or virtual health, is that in healthcare today, we get paid by encounters. So we get paid for doing things mostly face-to-face, in person. We don't get paid for preventing things. Payment is shifting much, much more to what we call risk-based payment or towards capitated payment, where essentially we're going to be paid to keep you healthy. And once we get paid for that, it also flips the equation. And so it makes much more sense for me to be connected with you digitally. If I'm getting $100 a month or whatever it is to take care of you, why would I have you come in and take up an office visit for someone that actually needs it, who's really, really sick? Why don't I just do that digitally or virtually? And again, so when we start to flip to that capitated, risk-based payment, I think that's also going to enable the digital health explosion.
You're a member of a leadership team of one of the larger health systems in the country. Why is there a race to have a digital strategy? Why is that such a catchphrase right now?
Well, again, for the reasons we just discussed, convenience for our patients and customers, healthcare consumers, cost, and of course clinical outcomes. From a healthcare institution, healthcare company perspective, I think we worry about a number of things in healthcare. Obviously, any company does, one of which is growth. And so we are trying to grow our practice. We want to deliver care to a larger number of people in our community. If you're not growing, you're dying, right? I mean, this is just a given. And so one of the things that digital health allows is it allows you to grow and grow beyond your footprint of the limitations of the capacity of your infrastructure, your physical infrastructure. If people can receive healthcare digitally, I can actually provide care to many more people. So number one, I can have a bigger impact in the community. Number two, I can grow my practice or grow my provider organization. And number three, the issue of affordability. We know this is a fact today. It's really tragic. Healthcare is increasingly unaffordable to the vast majority of Americans. It's the number one cause of personal and family bankruptcy. The stats are just alarming. And if we can lower the cost, if we can improve the affordability of healthcare, that's what we need to do that. And again, we need to do it for our communities, for our customers. We actually need to do it to grow and be viable in the future of healthcare.
Is there an existential threat to the degree that there are new entrants coming in who can nibble away at the high profit, outside edges, and talk a little bit about that?
Yeah, well, this is the American, market, right? I mean, it's if you've got a better mousetrap, if you've got a better idea, people are going to use it. And so if I'm forcing you to come and see me for conditions and issues, physical, health-wise, that you can get online literally by picking up your phone or opening up your laptop and receiving the same care, if not better care, at a lower cost, why wouldn't you do that? So I think this really is what we're in right now, which people don't understand, is we are increasingly in a consumer-oriented healthcare market. And people are voting with their feet, they're voting with their dollars, and they're going to go where they can receive the lowest cost, most affordable, most convenient, most accessible care that delivers the outcomes that they want. And I think digital is going to help enable that. Now, I just want to be careful to say digital and technology, and we have lots of buzzwords going on in healthcare today. The digital health, everyone wants to be doing digital health. Everyone wants artificial intelligence and machine learning. Everyone's talking about blockchain. Those are buzzwords. And I think all that technology, predictive analytics, et cetera, all of that, I think, enables better care. But what we need to focus on is actually creating better care and using those tools, but not thinking that those tools are actually that they're the answer themselves.
When you think about digital health, if we break that up between patient acquisition, the sort of marketing funnel stage of bringing a new patient to a provider, and then once that patient is a customer, the retention and servicing that patient. If you think about digital health solutions across those two venues, on the acquisition side, where do you think are the best near-term bets?
Right. The first thing we have to do is make it easy and convenient. Healthcare, there are scales that measure barometers out in the industry that measure ease of use and simplicity. Healthcare providers aren't even on the list. They're not even measured. Yeah. I mean, that's how frustrating it is to receive healthcare in our country. And there are lots of pain points. We make it harder for people to access healthcare than we need to. And so the promise of digital is that what people call that digital front door, where we make it easy for you to figure out, what type of doctor do you need, which specific doctor or nurse or PA, what specialty, how to access that, where to go, this sort of wayfinding or navigation, even some of the do-it-yourself options. I don't necessarily need to go see someone, navigators, coaches, care managers. All of that could be made much, much more simpler. Again, think about your experience shopping on Amazon, okay? Think about the ease, how easy it makes you do that. Well, could you imagine if we adopted something like that to healthcare? So that's that front door, that's what you're talking about. The second part I think you're asking about is once people are in and we have our patient population, where would I think it could be most well applied right now? There is an explosion of chronic disease in our country and across the world. If you look at the numbers, they're actually startling in terms of the costs. Okay, the World Health Organization predicted that for millennials, they're going to be spending something like 3/4 of their lifetime earning on health care. Okay, that's because of the explosion in obesity, in hypertension, in diabetes. It's not going away. In fact, it's getting worse. So with that, we need to use digital. Again, make it convenient, make it accessible, make it 24/7, make it so I don't have to go in to see someone. You make it easy, you gamify it, okay? You make it a game for me to be healthy. Again, that's the promise of digital. The other part, I think, which is also a huge cost issue, and I think from a patient or person suffering issue, huge, which is the issue of the elderly. Older people in their 70s, 80s, 90s who have complex chronic medical problems, okay? The system isn't doing a good job helping them stay healthy and helping them live out the rest of their lives. And digital has the promise to actually help that. If we could put monitors in homes, if we could, again, you're asking a 90-year-old person with 6, 7, 8 terrible medical problems on 15 or 20 medications who's wheelchair bound to leave their home to go visit their doctor for a half an hour. That's a full day visit. I mean, think about that imposition and inconvenience and the extra suffering it caused them. What if we could deliver care in the home, chronic care, care for the elderly in the home? Those would be the two main issues I would focus on. The third, I'm going to sneak in a third,
okay.
is hospital at home. Again, I've had the opportunity to speak to some experts in this area from across the country. This is happening, by the way, in other countries across the globe. At this point in time, probably a third of all hospitalizations can be done at the home. You could have a virtual care team literally connected with their digital monitors, receiving treatment in the home. It's actually it's not just as safe as being in the hospital, it's safer than being in the hospital. And so those are the three areas. The chronic disease management, the complex chronic care, and the hospital at home.
The challenge in these is the reality of payment system today. So going back to the digital front door, what are the things in the digital front door that can cash flow for a health system that has primarily a fee-for-service payment model? They want to be in population health, they want to take on risk, but not quite there yet. What are the strategies that can cash flow quickly?
Yeah, I think that's a great question. It's a great point. Again, I think if you start offering services like the do-it-yourself service, navigation services, people would pay for that. I mean, if you said to me, Zeev, we're going to monitor your dad or mom, so you don't have to worry about them. They have 3 or 4 medical problems. You're across the country, across the state, across the city. You're busy taking care of your kids. You're busy at work. We will monitor them at home. We will monitor their health. We'll provide you with a report. Again, all HIPAA. They allow for that. But I would pay extra money for the peace of mind that you're watching my dad. You're watching his blood pressure, his sugar. You're making sure that he's not falling down in the house. Those sorts of things. So I think that we can get very, very creative in these sort of digital health models.
So the concepts of digital health, the digital front door, the managing chronic disease, certainly has been discussed for a long time. But yet we don't have a lot of evidence of ROI and efficacy. What's going on? Why don't we see that evidence?
That's a great question. Well, first of all, there's a lot of things we do in medicine because they do make sense and they are almost sort of stepping stones. They're portals into a different future. For example, take the electronic medical record system, electronic health record systems. They've been around a lot longer than digital health. I've not seen much literature that would suggest that we actually have an ROI on electronic medical records, and yet they're not going away, okay? They continue to grow. So again, that's not a diss on electronic medical records, it's just to suggest that digital health is relatively new, and so it's still early on in terms of the ROI. I think though that, I think there's real validity to this question. I think there is a need for us to really ramp up the research on the outcomes of digital health. And again, it's an early field, and we're now still in that sort of feasibility phase of trying to figure out how to make digital health work. I think some of the literature would suggest that we've used the tool as a technology, as a standalone technology. It's sort of, if you slap a digital health device on my wrist, somehow that's going to, just having the device is going to, I'm going to use it and I'm going to be healthy. What we're learning on in the first few years is that the device, the digital, is an enabler. It's just a tool. You have to actually attach it to care itself, and it's much more complex than that. the whole field of behavioral economics and behavior change, the tool needs to be tied to something, okay? It needs to be tied to enhancing my relationship with care providers, enhancing my relationship with others who are healthy. And we know if you are connected to healthy people, you become healthier. We know that from network theory. So again, I think we're just learning that it's a tool, it's an enabler. How do we attach behavior change to that and behavior modification techniques that we know work from the literature and from years and years? And I think you're going to see in the next 5 years or so much more of that using the tool with gamification, behavioral economics, behavior change techniques, and I think you're going to see studies demonstrating increasingly that it is efficacious.
In your book, as you sort of journey from this concept of reframing from a marketing perspective, talk a little bit about where you go from there.
This isn't a model I made up. This is an empiric model. I noticed the front runners doing these steps. My concern is if you don't do all of the steps, you're not going to get the outcomes you want. So my goal over the next few months and years is to work with healthcare systems. I had the phenomenal good fortune of actually being called to the NCQA, the National Committee for Quality Assurance, a couple of weeks ago. A phenomenal group of people, just amazing to listen to them and learn with them. And we spent the day talking about the Reframe roadmap and the marketing mindset and how they could begin to adopt it and deploy it in their work. And again, they're thinking, the next 20 years, what is the next 20 years of primary care and healthcare going to look like? And I applaud them for that. And so we began to work in that way. So I'm hoping that people will adopt this mindset because I do think it is the solution to the major dilemma we have in healthcare today.
Talk about the milestones on that Reframe roadmap.
So there are 7 steps, and it's sort of combining the Reframe roadmap with the marketing mindset. The first is we need a new orientation. We need to reorient. There's 7 R's. We need to reorient healthcare. And the orientation, I think, is largely this marketing mindset. I think there's another orientation, which is along the lines of the social determinants of health. I talk about that a little bit in my book. In fact, I devote a chapter to it. I tried putting it 3 chapters. The editors took it out and made it 1 chapter. But so much of healthcare is dependent on these social determinants of health. In fact, people say the majority of health outcomes are not what we do in the hospital or in the office, but what happens in the community. So I think reorient ourselves. The second is once you have this new orientation, you have to redefine the problems. And this is probably the keystone of the whole thing. We are so programmed to jump to solutions, right? We want that shiny new object. There's a vendor out there, there's a product out there, there's a technology out there, and let's just do it, right? And I think we have to stop and think. And we have to define the problem we're trying to solve. If we skip that step, we will be circling, I think, forever. And so the redefine, once you redefine the problem, then you have to rebrand. You have to begin to understand the value proposition you're going to offer your customers and consumers through their eyes, okay? So branding is not a logo or a jingle or a color scheme. Branding is really what is the value you are bringing to the world, to the universe, to your customers and consumers. Once you rebrand and you know that value proposition, then we have to start to redesign from a human-centered perspective with different results, okay? And then the last 2 steps are critically important. This is the launch, okay? You could do all of that, and this is where I see a lot of organizations get stuck. I think they get stuck in the redefine stage. I've seen them get stuck in the redefine stage, not taking the time to define the problem that they're trying to solve. Again, it's so easy. What I see, and I see this individually, and I see this in systems, we love to solve the problems we know how to solve. Okay? It's a great thing. That's why email is so great. I know how to solve the email problem. I just answer my emails. The real problems, I'll put them off. And so, but that's why we have to redefine the problems for the future from the customer perspective. I see people get stuck in organizations get stuck there in the redesign for different results. The biggest challenge is actually to reorganize. And I mentioned some examples of healthcare systems that are reorganizing. You cannot stay the same. Your legacy organization is probably not built to take you into the future, especially once you've reoriented, redefined, redesigned for new results. You need a new organization. So you have to reorganize. And this last step is also that final liftoff, which is you got to put your money where your mouth is. You have to redirect your strategies, your tactics, and your resources. And if it's just talk, or if it's a small initiative in the corner that gets a few dollars, that's not what I'm talking about. And so those are the 7 steps. Reorient, redefine, rebrand, redesign for new results, reorganize, and then redirect your strategies, tactics, and resources.
When you wrote the original manuscript, you shared it with a bunch of folks to get their feedback. And that actually led to a redesign. Talk about that.
I had actually not shown the book to any physicians or healthcare executives, and it was in its final form. And I got a little worried, and I thought, I want to, obviously I have a message, and I want to help transform healthcare, and I want to help health leaders, but I wanted to make sure also that I did not offend anyone. So I handed it, the manuscript, to 4 or 5 colleagues across the country, and one of whom was in my own institution. And I said, don't read this to make any changes, substantial changes. Read this. I want to get your gestalt of how this comes across to you. And if there's anything offensive in it, I want to remove that. So I got very, very good feedback, very constructive feedback. People read the book. I know that because they were putting pen marks all throughout the manuscript. Literally every page was marked up, and it was really helpful. One of my colleagues and friends and even mentors who works with me, I went to visit with him, and I said, okay, take me through your copy and tell me what I need to do to get the book ready for the final manuscript. And he turned to me and he said, Zeev, this is what we need to do. And I tell you, I had such a huge sigh of relief. I was like, whoosh, but he said, we need to do this. And I said, yeah, no, I know. He says, no, we here need to do this. If we don't do this, and other people across the country start to adopt this, shame on us. And so, in part as a result of the book, him reading the book and our conversation, he began to launch essentially a new care division with another one of my colleagues and mentors as well. Together, they got together. They both had read the book, and again, I don't want to take credit for what they did. I'm just saying that I think it helped catalyze this final step, and actually, we created a new care division based in part on the book. So it's validating and it's encouraging, and it makes me think that there's hope for healthcare in the future.
One of the observations that I've made of healthcare leaders, particularly healthcare leaders who came from a physician training, a practicing physician background, it almost seems like there's this journey you go on where you start off with a focus on caring for individual patients. That's your motivation. And then at some point, as you mature, you start to reframe the value that you're getting from your experience to caring for the system and caring at a systemic level as opposed to at an individual level. Does that resonate with you?
It does. I think, and I won't speak for other physicians or physician leaders, but I think those of us who get into so-called administration or into executive and managerial roles, I think, especially those of us who come from the provider side, from practicing and taking care of people individually, I think there is just a realization that the system is actually not supporting us. It's actually working against us. And by I mean us, I mean doctors and patients. And there's great evidence to support that statement. And I think you begin to realize that if you're really going to deliver the care that you set out to deliver when you first went to medical school and residency, you're going to have to change the system. And if we don't change the system, things not only might stay the same, they can actually get worse. And so I think quite honestly, I think it's a calling. And I think it's one of the most critically important callings in our times. I mean, there are other issues afoot in our society, but healthcare right now makes up 1/5 of the US economy. Our lives are dependent upon it, right? I mean, we need good health care. Everyone needs it, and I believe deserves it. And so I think this is, I think what I'm involved in, what my colleagues are involved in, what the leaders in healthcare are involved in right now is I would say it's an inflection moment. It's a moment in the history of healthcare where we have the opportunity, and I think we have the choice to either maintain and sustain the current trajectory, or to actually make a huge positive inflection that will last for decades in the future of healthcare and, quite honestly, the health of our country.
it's important work, and thank you for your book. Thank you for the podcast, which also is a regular part of my podcast diet. I enjoy the interviews that you record. And thank you, Dr. Zeev Neuwirth, for joining me today in the Business of Healthcare.
My pleasure, Matt.
Watch, listen, or read Business of Healthcare interviews at bohseries.com.